It's good to see you again, Senator. I'm wondering, is the U.S. at war with Iran or not?
Well, as you point out, there are a lot of mixed messages coming out of this administration. I wish President Trump would stop negotiating with the administration and start negotiating with Iran, because I think that's the best way to get a resolution for what's going on in the Middle East. And so far, we haven't seen a clear strategy. We haven't seen what the end game is, and what we've seen is higher prices for Americans at the gas pump, in the grocery store. In so many ways, we've seen the Strait of Hormuz continue to be closed. We have seen no plan for dealing with Iran's potential to get a nuclear weapon, and we've seen no way to address their support for terrorist groups across the Middle East. So none of the stated goals that President Trump said he was in this war for have been accomplished, and Americans are not better off.
And we are now past the 60-day mark of the war, I don't have to tell you, and that is when the White House is legally required to get congressional approval. But yesterday, Secretary Rubio argued, in fact, that's not necessary. Here's exactly what he said.
The War Powers Act is unconstitutional, 100%. Now, this is not the position of me, not the position of the President of the United States now. This is the position of every single president that has occupied this position since the day that law passed. It's completely unconstitutional. Now, we comply with it in terms of, like, notification because we want to preserve good relations with Congress, right? And we do that. But even as a senator, I would say that the War Powers Act is 100% unconstitutional.
Do you think at this point, Senator, Congress just simply isn't going to or can't do anything to rein in the president's war powers?
Well, I think that's still to be determined. And we need to look at all of the requests and the actions of this administration. They have not had one open hearing in Congress. The president did not come to members of Congress to talk about his interest in waging war against Iran. He didn't listen to the intelligence community either. He has not talked to any of our allies about that effort. The only information that's shared with Congress has been in classified settings. So until Secretary Hegseth came before the Armed Services Committee last week, there was no open hearing on this issue. And we are 2 months into the war in Iran. So I think the president would be better served if he had made the case for why he was doing this. I think he would also have hopefully listened more to some of the voices that were expressing concern about his plan to go into Iran, because clearly it hasn't worked the way he thought it was going to work. And Americans have been paying the price.
I want to ask you about another affordability issue. You mentioned, the costs that are going up for your constituents and all across the country, including gas prices. But a new Kaiser Family Foundation poll just out today found that 61% of voters say health care costs will have a major impact on who they vote for. We know Americans are highly concerned about their health care costs, and you recently introduced a bipartisan bill to tackle the cost of the single most expensive chronic disease. Can you tell us about that?
Yes, I'm actually here at St. Anselm's College in Manchester, New Hampshire, at their new School of Nursing. And we just had a discussion with medical providers, with those with type 1 diabetes, with advocates, talking about the legislation that Senator Collins and I have introduced that would cap the cost of insulin at $35 a month. We did that 2 years ago for people on Medicare, but for people who have health insurance, they're still paying much more than that in most cases. So this would cap the cost of insulin, and it would set up a pilot program for people who don't have health insurance to be able to cover the cost of insulin for them as well. As you point out, this is a number one issue for my constituents who are worried about how they're going to be able to pay for their health insurance. And this president has done nothing to address it.